Thank you very much. Let's appreciate choice. We shall have our children here from Gorara Special School doing their presentation down here.
Thank you so much, Your Excellency the Governor, stakeholders from Tenno Hospital, CBM team. Good afternoon, or is it morning? Now, this is called a special school, and most of us, we had gone for holidays, and therefore this is just some of the children that were able to, connect with them, and then we bring them here. Okay, some people are saying that they should go to the
Let them do their presentation when they are there.
Yes, so I was saying that we couldn't get quite a number of them, but these ones are children who have benefited from the support of the county government of Bomet, Tenno Hospital, CBM team. The white canes, the surgeries that we've seen is part of the work that you people are doing. So we are really grateful. There are some braille items. This paper is a braille paper, and this is Kipruto. He says that he wants to read a part of the poem that we gave him, although he didn't get enough time to master. But he can read right now. He can read braille together with Kennedy here. These are children who are totally blind, but they are able to read now as we talk. So I don't know if Kipruto is ready to read for us. You're ready? No. He can just read while standing.
A grateful light. A grateful light in Gorara's halls, where a dream takes flight. A beacon shines so clear and bright. To Bomet hand.
Thank you so much. I think Kennedy can also read something. Are you ready, Kennedy?
So firm, so kind. A grateful light in Gorara's halls, where a dream takes flight. A beacon shines so clear and bright. To Bomet hand, so firm, so kind. You have opened eyes, transformed the mind.
Thank you, Kipruto. Faith, do you have something? Okay, but all these children can now read. Now, we had an item. Maybe the others who have some vision can assist us to say the whole thing. It was a way of thanking you people for the support you've given us. We are so grateful. That is what the poem is talking about.
Gorara Special School, recite the poem entitled A Grateful Light. In Gorara's halls, where dreams that fly, a beacon shine, so clear and bright. To Bomet hand, so firm, so guide. You have opened eyes, transform the mind. With every gift you choose to share, you showed us hope, you showed you care. Why can now that we steady beat, very lasting song, so soft, so sweet. Magnifiers, peppers and boast, restore the vision, once thought lost. Your kindness help our land see. A word of hope, a life set free. Then work healing, hands so through, checked each eye and made it new. Surgeries done with scales and light. Put back the smile on every face. Training care and Tara scan. Rewrote the dreams of every clan. CBM stood with heart so wide, creating awareness, walking beside. Through every school, you spread the word, so that each voice of hope is heard. Enrollment grows, the future bright, because you thought to photo.
Thank you so much. If we had a full team, you would have known that, you've really assisted us. Kennedy here wants to say something, also using the fingers. These are our eyes. We use the fingers. Kennedy, you ready?
In cholera, holes, trims, and right.
Thank you so much. What you only need is your patience. Sometimes people are so impatient, they want to move on. But now that we are using our fingers to read, but we are so grateful. We can feel the impact. Right now, as we talk, there is no child that was left at school. In the past, special schools were a dumping site. Parents would bring their children and leave them for the next 8 years until they do their KCP and proceed to the next level. But as we talk, no child was left at school this time. Every parent came to pick them. So we had to connect with them so that we can assemble here. Otherwise, thank you so much.
Thank you very much. Let's appreciate our children with 3 good clap. 1, 2, 3. Thank you very much. Thank you very much, Mwalimu and the team. We had 2 members of from the community. Elena Meonge. We have Morius to represent the male gender. Mr. Morius. Umosinu. Those are members from the community. Karibu sana, Mr. Morius. Karibu sana.
Kongoi mising ano somo korona ando unena kachaka le ko muni atugul o chamge kabana amache kewe awe kikona kongoi kabana amun enchi no moge dang de mosop sobi ko moge do le ka yo petu de le nyoy ko nyege mi chi to ne nge bi chugura yugi nya ko gi re bi ja ta ge bi we ti ki chugoni na we sa ko bare ya ge di chege Longisa wolia mo na ko nya ko ko ge chege Longisa kondo ala kap ne bi ju Bwana excellence ila barcho kage we gongo ko en sipitali ta ko nyek ne gadi yo twitch mo ge gini mo e de mo to ni gereza lakini chita ne we ndi oli bana ina be nyok te be sinyo ko yitwe mulango juna ko nyok bare ya Longisa ko muri Longisa ya ge di chege mi de Longisa Bwana barcho ke jera ni munga ti no be ge ngi bari ko to ge kinate no ba sene sige ge ba jone ga bi chita no ma ye ge ina ma ye ga sine ge gure sene ta ne mo ge ge ga sinyi ko ne Kimani si bundi nyo nyota si gege kwa icheta bionto. Allo? Oko so andu kulo? Tiba seges? Kechere ta sene Kotom keker boisienyin kakai ono bo MCA kikere anan kakeboli chamori yende yu kele bakayai torani konyo konde wei konyo ko karani toret ke mongu ibote sipitali batyo kele ni kayai mamiten kerichek yon konyo konde kerichek ko nguni dentist to yon ikere ketururu kerichek ko kerichek ko je ajeno bikyo alamo kere alamo kose so Martina nabas no missing 2027 kimi pamoja kejera na ngubi siptoi enyo miten bwana excellence kwa wanataka bwana basena sikegeri lawa ngam sana kineu ko kegeri chebo gabana kimagi sibu ngora nyoni ile kidogo ange no lenye we mingi ni tete gole na ni ngomna tete tinyo go gosir ngale kecha so matono ibna bas no missing kaine jogo morio e log sani no ko yo ni wase ngwa ni chito je ngana ma di me ni so ngwa no le ki ya ide si bo imagi ne gidi ya ne ba ba jogo to abu to tendo go ni to e je bo te no je bo no mi jubera taliane mi pa mi jube ni sitata ko je ne ga yo tweche ni no ko pina we ni ungi ja ko mo ko ba ye ko ya ilo bisa ye ko ya ilo ya lo bisa no ana mo gere otherwise Martina ngala je tang missing yes.
Thank you very much. Mwashini wa Nut. Haya ni maneno ya nyumbani. The visitors, that is one of our own, one of our voters. Amesema you are all welcome. Mwashini Nut. Thank you very much. And let me welcome Madam Faith Langat, Program Manager CBM Tenwek. Madam Faith. Let's welcome her with our clap. Karibu sana madam. Karibu.
Your Excellency, Honorable Professor Hilary Barchok, our Deputy Governor, the Speaker of the County Assembly, the Chair, Assembly Committee on Health and Sanitation, and all members of the Senate, County Assembly, good afternoon, and all, I'm not so good in this, but, and all protocols observed. Good afternoon. I'm really delighted to see all of you here. Welcome so much, feel at home. This is Longisa County Referral Hospital, a hospital that Tenwek Hospital really associates with. Also, we have worked and partnered with this institution. I look back at 3 years ago when we stood in these same grounds to launch this project, so that you could launch this project, Your Excellency. And when I reflect back, it's just amazing. The people we had during the launch were less, the people we had impacted were less, but this day, we talk about huge numbers and huge successes. I had written a speech, but on the way, my speech is somewhere here. So I just want to highlight the key impacts or the key achievements of Vision Impact Project in this county. When the project had 5 key result areas, and in these 5 key result areas, we achieved 100%, if not more. We overachieved. The first result area, the project intended to improve or to strengthen health systems, and we did this through renovations of our facilities, making sure they are ready for the uptake of eye health services. And in this results area, the first and the facility that we just relaunched, because it was here we just did the renovation, was Longisa County Referral Eye Health Unit. Secondly, we also managed through Kenya Society for the Blind in this county, we managed to renovate our education assessment center in Bomet, which is stationed in the Ministry of Education. We also renovated Kiriba Primary School to make it a model school for inclusive education. We also renovated our sub-county hospital to make them accessible for persons with disabilities. When you go there, you'll find some of the things that were not accessible. For example, we trained personnel on sign language. We have our charters printed in braille just to ensure they're accessible. We have adjustable beds, we have wheelchairs, we have ramps, and also even just the drop-off points in our sub-county hospitals. Some I know are still under construction, but the contractor is on site. We also, in the same results area, we also conducted the RAB survey through the National Ministry of Health and CBM. And in this county, today our governor was handed over the RAB report officially in our county. This is a document that really will be the basis of our intervention in matters eye health. In the second, in the same results area still, we managed to take many personnel through trainings, through higher diplomas. We have 14 members of staff who underwent higher diploma in various eye health courses. We also have personnel who underwent 3 months training on primary eye care, and there are about 27 of them, and those who underwent sensitization of eye health training were about 218. All our facilities have been sensitized on eye care. Also we have our teachers trained on eye health identification, prevention, and referral of children with eye health problems. And these teachers we trained over a 3-week period. We trained 1,200 teachers. So each school has a teacher trained on eye health. Further, we also did a lot of screening in our communities. That is our second and third results area, where we did community and school screening. This was a very unique project, a very well-funded project. Thank you to CBM and BMZ. We lacked no resources. We transversed this county, Your Excellency, and there is no community unit that we did not reach. And this, I must say, was one of its kind. Every day, our community health promoters and our community health assistants were out there screening, identifying people with eye problems. And we also had a team of clinicians from both Tenwek and Longisa and the sub-county hospital doing treatment outreaches, and also our hospital ready to receive. And this improved the demand for eye health services in our county. If you ask anybody now in our county if they are aware of eye problems, they'll surely talk about something about eye health. We also went to our schools. Though in the schools we managed to hit our target, we still have a gap because we did not reach to all our schools. We have some schools we have some zones which we did not reach, and it is a good thing also, because it means we are still needed here. We still need to reach those children who we left behind. We also, the last target was to improve governance. And I would not want to talk much about it, but because the county director has talked about it, but we managed to form Eye Health Technical Working Group, which is vibrant. It is working both in the county and in the sub-counties. We also have health representative just to keep the nutrition, just to keep the eye health matters continuing in all levels of care. We managed to screen, I just forgot something, we managed to screen over 600 people in our community. We managed to do both Longisa and Tenwek more than 1,800 cataract surgeries, and I think it deserves a clap. So that I don't take so much time, let me just give thanks to some special teams. In governance also, we managed to develop our county eye health policy and strategic plan. It was not an easy job, and I must say special thanks to the secretariat and also to the County Assembly, and of course to your office, Your Excellency, and to the Department of Health for holding us and ensuring that we deliver these two documents within 3 months. I don't think it is a small achievement. It is a very big achievement, considering that the policy, eye health policy, is the first in this county. So I know this forms the sustainability plan of our county, and also our counties that are beyond Bomet County, since we serve even nearby counties. Let me just take this time to recognize and give special thanks to the Vision Impact Project team. Just please stand up. Vision Impact Project team. Yes, so we have Betty, we have Dominic, we have Raymond, and we have Matthew, and also we have Chirchir from Kenya Society for the Blind. This team worked tirelessly to ensure that we deliver the project as it was designed. I usually tell them, if the project was not delivered as it was, it's not because we did not have the support of our county or the support of our hospital as an implementing partner, or because of lack of funds. It would have been because of our negligence, if I may say so. But I am so happy with this team because we worked tirelessly to ensure that the project was delivered. Also, special thanks goes to the Department of Health, because of they held our hands. I think we've had 3 chief officers in that department. We've had 2 directors of health or 3 directors of health, and there have been many changes, but we did not feel any kind of a transition period. It was seamless because this project was 3 years, then it was really very seamless. We were able to achieve what we intended to achieve. Let me thank the community health strategy, our community health promoters, and our CHPs. Raise your hand, just stand up, I recognize you. Community health promoters and community health assistants. Yes, these men and women represent 108 that we trained, who traversed this county, ensuring that we did both school and community screening. Your Excellency, this is a great team that you have here. They are men and women of integrity. We worked tirelessly with them. Thank you so much. They are led, their leadership was very seamless. We just rode on the community health strategy platform. We did not have to invent anything. Let me not take so much time. I am so happy. I am so pleased. I thank TSC for the support. Ministry of Education for their support. Big Technology, you did amazing. The technology, Mr. Rono, works. Dr. Gishangi, and what do we say? He's such a humble man, and he really supports us together with Dr. Vito from the national government. Our CEC, what do we say? We really thank you. And to our donor, CPM and BMZ, thank you so much. I can continue for hours on end, but I think this is it was just to say thank you to each and every one of you. Our team from Tenwick Hospital, please stand. These men and women represent Tenwick Hospital and the I unit led by a director of nursing services. They've done a great job. Sometimes we admit so many patients and they never complained. They did the work as it were. Together with our Longisa County Referral nurses and doctors, thank you so much for ensuring that this project came through. Thank you so much.
Thank you very much, Madam Faith. Even after forgetting your written speech, you can be able to memorize all what was in that paper. Let's clap for her. Thank you very much. Let me take this opportunity now to welcome our Chief Officer, Medical Service, Mr. Langat, to continue with the program. And as he comes, I can say I am Langat Paul, the Sub-County Administrator of Bomet East. Welcome to this great sub-county. Welcome, Mr. Langat.
Thank you very much. So, Your Excellency, Professor Hilary Barchok, Governor of County Government of Bomet, CPM Director, Global Program, Mr. Niang, CPM County Director, David Munyendo, Dr. Kishangi, our Speaker, members of the County Assembly, and all protocol established. Good afternoon. Good afternoon. So, Your Excellency, I want to take this opportunity to first welcome all our guests to Longisa County Referral Hospital. This is a great day that we are going to launch one of its own policy, and I should say from the onset that we are the only county that has managed to pass this policy. And for that, I really want us to appreciate our members of the County Assembly for ensuring that we beat the timelines and we also deliver within the timelines. So I'll request that we do it in a very systemic manner. So I'll say 1, we clap, 2, and then 3. So let's clap for our members of the County Assembly. 1, 2, 3. So number 2, Your Excellency, and we have a very short assignment, and the assignment is to invite some of our partners that we are here together. I should say again that is the issues of eye, just like any other issue that touches on health, is one of those issues that requires multi-sectoral approach. In here, we have representatives of several of our partners, and I want to give them just a minute to just say a word in the interest of time. I will start by requesting representative from the National Council for People Living with Disability, Consolata Wafula, to just say a word. As she comes, a representative from the County Director of Education, please step forward so that immediately after she leaves. And TSC County Director, please, you'll be next. Kenya Society for the Blind, Executive Director, Mr. Samson, please come forward. Big Vision, Dr. Hilary Rono, please step forward. And for Tenwick Hospital, Motai, you'll stand in for both our Bishop and the CEO Tenwick Hospital. County Director, No, hatuelewana kidogo. So, Consolata, please.
Okay, allow me to use the already established protocol. Good afternoon. My name is Consolata Wafula, the County Disability Services Officer. And it's an absolute honor to stand before all of you this afternoon, just to pass our sincere gratitude. That is on behalf of my organization, that is National Council for Persons with Disability, and on behalf of the persons with disability in Bomet County. We cannot say thank you enough to our partner. We are really grateful because this is a program that has walked the journey with us in ensuring that we meet our mandates. As you know, one of our core mandates is registration. And through CBM, we have been able to traverse this county, the 5 sub-counties, to ensure that we have registration activities, and we say thank you. We've also had awareness created through the disability inclusion training, which was done just a few weeks ago, and we really say thank you. We've also had a great impact on the community through the community screening and the school screening. And as you know, this will go a long way in arresting these cases at an early stage, so that those which can be treated, and these people can live their normal life. Because yes, in as much as our mandate is registering persons with disability, we are not just in the business of waiting for people to maybe go blind or lose their sight so that we can register. It is a great pleasure to have walked this journey, and we know that this is just a genesis of more partners who will come on board and take it up from where CBM has left. There's a common proverb that says, if you want to go fast, go alone. But if you want to go far, go together. We believe in Bomet County, we will go together, plus other partners who will be coming on board, so that we can move the agenda of this county to another level. So thank you very much, and accept our humble and sincere gratitude. We'll just lack words to say. I'm so much grateful, and having been part of the Secretariat, it also gives me that opportunity to say thank you, because I know that the issues of persons with disabilities were raised, and when we will start implementing, I know persons with disability will accept that indeed they were taken care of through my representation. Thank you so much, and God bless you.
Thank you very much, representative of the County Director of Education.
All protocols observed. Good afternoon. My name is Agnes Cherono Ngeti, Cast of Bomet. I'm here representing County Director, Ministry of Education. So on behalf of our office, we would like to thank our partners at the CBM and the stakeholders. This is a very good step, especially for our learners. This makes us to identify those learners early enough for correct placement. So let us soldier on together so that we solve the case at an early age, especially for the learners, and for the elder people, we assist them. So with those few remarks, we say thank you.
Thank you very much. TSC County Director Representative. Karibu sana.
Thank you so much, His Excellency, the Governor of Bomet, Professor Bartok, Deputy Governor, Speaker, and let me please write on the protocol already observed, established. All the members, good afternoon. I'm Dr. William Yator, TSC County Director Bomet. I'll be very brief. One is to thank most sincerely the organizers, the benefactors of this program. When our teachers were trained, I really saw something. There are some changes. I want to thank, in the county we have 5 sub-counties. Teacher Service Commission has employed officers, 1 officer in charge of every sub-county, in charge of SNE, Bomet Central, Bomet East, Chebalungu, Kondoin, and Sotik. And one of them, Madam, CSO. Do we have other CSOs in the Bomet East? Okay, yeah, that is Chebalungu and Bomet Central. Maybe your other colleagues are in other assignments. 5 of them. That is to identify all issues, children with disability. You have seen cholera, what they have done. Even Kiriba and other schools. And I will take this opportunity to ask, to request our governor, maybe the 5 officers plus myself and the sub-counties, we shall come to your office. We discuss because of the staffing position of these schools. They need more teachers. What is happening? We are still in around 10 or so teachers. We shall see what to do. So that is one. Now, the schools who have been trained, the teachers, have received a positive impact. We have told them, after the training, they go back, sensitize even the children in school. This one will stop, at least so that we don't lose our eyesight and what have you in school. And that information is very important. The teachers are already doing that during assemblies and even during parents' days. We shall request this project to continue to cover the remaining schools, because Bomet is actually very fast. Up to Chebalungu, the other side, Kaboson, all those places, is not easy. So I will request the organizers, maybe half of the county, not yet, if they can go all the schools in Bomet, 600, 700 primary schools, and then 300 secondary schools. If you can complete, we shall really appreciate as a county. Because of this, I want to take in a special way to thank our governor for the enormous work he's doing for the county. Thank you. Continue serving the teachers, and we shall really appreciate. With these few remarks, therefore, I thank the team, all of you present, for the team spirit. Very important. Disability is not inability. All the medical staff, I didn't know Longisa is such a very big hospital. When they say referral, this was my first time to be here. Thank you for that. The management of this organization continue doing the same, and also the graduates, medical staff, let us help our people. ILT County, we shall continue and well. Thank you so much.
Well, thank you very much. That's all. Thank you. And thanks for confirming that Longisa is one of the best facilities. Kenya Society for the Blind Executive.
Your Excellency, Governor Bomet County, Professor Hilary Barchok, Deputy Governor, Director, CBM Global, and the Country Director Kenya, CBM, CEC Health, Bomet County, Director, Special Needs Education, recognized also Dr. Gishagi, who also sits at the KSB Council, as maybe representing the PS there, and all protocols observed. Allow me, Your Excellency, to thank you for the support that you have given the work that we have been doing under the VIP project. Allow me again to recognize the KSB team that has done the work. Just stand and wave to the crowd. Solomon, Chief, they have done a great job because we've made a lot of achievement. Your Excellency, the Kenya Society for the Blind is one of the oldest organizations in this country for persons with vision impairment, established under the Act of Parliament. Your Excellency, I stand to represent my director,
Mr. Samson Waweru, who has traveled to Berlin for the Global Disability Summit. He could not be here, but he has sent his greetings, and he has our support. Your Excellency, the work of KSB revolves around prevention of avoidable blindness, rehabilitations of those who must go blind. And I say must go blind because if the cases cannot be prevented, we undertake rehabilitation. Then we complete the entire journey of provision of comprehensive eye care services through support to accessing inclusive education. KSB is one of the organizations that provide that unique service in the country, ranging from eye care, rehabilitation, and access to rehabilitation services and education, inclusive education. Under the VIP partnership, Your Excellency, we managed to achieve various achievements, as it has been outlined here by Faith, but I will just mention a few. This includes provision of glasses, which amounted to more than 19,000, renovation of the IAC, renovation and equipping of Kiriba Primary School in preparation for inclusive education, training of teachers on low vision, training on community rehabilitation assistants, CHARS, and the community health assistants, among other deliverables that we managed. We also managed to equip the optical shop at this facility which you have seen, the optical shop at the Kiriba Referral Hospital. We've also worked with the other partners, amongst them Tenwek, among the county health systems to achieve all this. Your Excellency, with the support of CBM, we've been able to train 19 teachers and CSOs on special needs education. We've worked tirelessly, and we've invested through CBM 29 million Kenya shillings in delivery of the role that KSB was bestowed under this partnership. Your Excellency, on top of that, as we close this project, we still continue, we'll try to continue to work to ensure that all the efforts that have been put under the VIP project are sustained under the other KSB programs. And this I say confidently because the project lies within a department that I head, that is the education and rehabilitation, and also our fellow, our colleague, promotion of healthcare service, that is eye care department. So we'll do everything to ensure that we sustain all those through creating more partnerships and also through fundraising for more support for this county. This is #1 county, as you've heard, and for KSB work, it is and it has always been our #1 county. For this reason, I want to say that in the South region, the provision of services, KSB services within the South region, Bomet is the headquarters where all the efforts are coordinated by our able officer, Bwana Chirchir. I want to take this opportunity to thank Mr. Solomon Bukhala, who is the VIP coordinator for KSB all over the country, for the work that he has done. It talks for itself. I don't need to give all the deliverables because they can all be seen. You also saw Faith here lost her written speech, but she was able to outline what has been done. I also had a message from my director, but I don't need to read it because it's something that we have done. It outlines what we have done, what is being said, and what everybody have seen. So, Your Excellency, I want to thank you for the support. I want to thank the Bomet County team for the support that they have been giving. We shall continue to work together Next week, we will also be here the whole week conducting reviews with the CRAs and the CSOs and all the stakeholders within the education, eye care, and rehabilitation sector, with the social services and all other stakeholders within the county on the impact of this project. So our work, Your Excellency, does not stop with the end of this program. We continue moving from where we stop. So thank you so much, and I want to wish you all the best. Thank you.
Thank you very much. County number 1. Let's appreciate ourselves for that. And Big Vision, Dr. Hilary Rona. Welcome.
The chief guest for today, Your Excellency, the County Governor for Bomet, Professor Hilary Barchok. I will stick to all the laid down protocols. As we celebrate together, I'm glad to join you in the celebration of the achievements that we have had in the last 3 to 4 years. Peak Vision is a social enterprise that provides software that is used for screening and data insights. We are very grateful that we are part of the team and the VIP project that actually delivered all the good results that you have seen here, screening over 600,000 people, which is almost 60% or 70% of the population of Bomet. I've not come alone in this process. I've come with a team from PIC. So may the team from PIC please rise up. We just recognize you. Yes. So we let's give it some clap, please. Yes, we have Cosmas, Ronald, and Grace. Thank you very much. Yes, for joining us. So as a part of PIC Vision, it's been a journey over time. It's also personal to me. When I was a doctor, I was posted to Bomet County, that's Maravin, and I had something enter into my eye. I had to drive 60 kilometers all the way to Nakuru to have it being removed. That took me almost an hour. At the back of my mind, I said, if a doctor would have that challenge of driving 60 kilometers, what if somebody wouldn't have those means? So I asked myself exactly why we didn't have eye doctors everywhere. That's why I went to school. When I finished school, as an ophthalmologist, I was posted to North Rift in Trans Nzoia. And in Trans Nzoia then, my main concern has actually been people to actually have access to eye care. And in that case, in 2014, we actually joined a team to develop the first school screening project. And we celebrated when we screened the first 21,000 people, children, and we did it in 9 days. It was a great achievement. Then we said, no, that's not enough. Let's actually spread it further. And we screened the next school, all primary schools in Trans Nzoia. We were able to do it. That was in 3 years. We screened 200,000 children, and that was done in almost about 2 years. And that was also a great achievement for us. And from there, then, the scales have actually been going up and up. African Union came to us and actually assessed, and they found that the digital program that we're running was very good, and it was ranked the best in Africa. And from there now, we have actually been spreading, and I'm glad that actually Bomet has been the first county, one of the first counties to really implement the project. And having screened 600,000, it really adds up to what our vision of improving access to the people. In Kenya at the moment, we are screening about 5 million people. Globally, it's about, we have about 10 million people. It is a challenge with technology. I'll just tell you. Technology, it took us close to 10 years, from 2013 all the way to 2021, to screen the first 1 million people. And it only took us 2 years to screen the next 9 million people. We are now We are screening almost 10 million. We have screened almost 10 million people. About 500,000. We are doing it every month worldwide. We are now from a small project in Trans Nzoia and now the first county in Bomet. We are now in 12 countries in Jikumi na mbili and worldwide. And we are running about 82 programs. But the lessons we have learned from here is enormous. We have learned enormous. So like for Kenya, for example, we have screened about 5 million people. We found about 1.4 around have a problem, and around 900 have been connected to care. Similar to the findings you are having there, 600 screened, around 130 having problems, and about that number being connected to care. That's a great achievement, and it's achieving our mission of basically connecting people to eye care. So that still resonates back to me. I thought at that time I've actually learned a lot. And I really reflect a lot, and I've learned a lot. And being here, I'm really very happy that part of the lessons I was reflecting, one of them is personal, and I think the others will be scientific. So the first one I know, the chief guest today, your name is, the first title is actually a professor, second one is Hillary, and the other one is Barchok. Mine also, the first one is a doctor, second one is Hillary, and the other one is Rono. But now, I don't know what I want to do. The first one to change from a dear, a doctor to a professor. We'll meet behind the tent, and then we see how to do it. So second one is that, I mean, having learned all these things, I hope I'll try to convince you that maybe I'll add that title. So what have we learned over this time? First of all, is that out of 100 children in Bomet, 75 are normal. But there are 25 who have a problem. And those 25 who have a problem, around 8 have a problem that requires spectacles, and the other 17 requires a problem that requires treatments. And I'm glad you have opened all these hospitals here and everywhere, because we need to treat them. That's one lesson I've learned. Number 2, in the communities, all Chebalungu, everywhere, Konoi, everywhere, out of 100 community members, 60 are normal. 40 have a form of a problem. 10 of them will require, that's 10%, will require a problem requiring spectacles for seeing far. 10 will require a problem that require reading glasses. Most of us actually have a challenge reading those who are over our age. And then the other 20 requires a problem that needs some treatment or surgery, and that's why we're establishing all these things. And that was not possible if it were not for what we have learned here. And apart from that, the team in Bomet now, they no longer require Cosmas, Kefa, or to come and train you, because all of you have already have an inbuilt team who have been certified and now are trainer of trainers. Next time, whenever we have a project to be launched in another county, we'll just come to you and say, can you go and train that team? Because now you are a resource for our team. And you have built that team because we want to sustain all those services. So because of the good things that we have learned over this, we are saying we need to sustain that, and we have made a decision actually to make Big Vision to be big, the software to be available for the county even after the program is closed. So the county can still use the software so that we can still harness all these benefits that we have had way after the program is closed. So the project is closing, but we are opening a new one in Peak, and we are very, very grateful. The whole reason for this is that we want to achieve access to eye care for everyone. Thank you very much, and may God bless you.
Thank you very much, Director. Thank you very much. So we also have our regional nutrition. Martha, I request that you come forward along with the regional director of NI. Martha, karibuni sana.
Your Excellency Governor, Your Excellency Deputy Governor, all protocols observed. My name is Martha Nyagaya. I'm Bomet County since 2019. Today is not our day. We just came in support of Bomet County because we are a friend of Bomet County, but we also would like to foster partnerships across partners that are working with Bomet County so that we can join hands in supporting health and nutrition programs. I would like to hand over the microphone to our regional director who has worked with CBM before and has recently joined NI for a few words. I thank you for the opportunity. Success has many fathers. So we are happy to wear the hat and thank CBM for welcoming us to celebrate this success with you. We know failure is an orphan, and so we join in your success and thank you for this effort with Bomet County. Thank you.
Thank you, Martha. Martha is the Country Director for Nutrition International in Kenya. Your Excellency, the Governor, Professor Hilary Barchok, Your Excellency, the Deputy Governor, Shadrach, the CC for Health, Dr. Stonik, the Director of Health, the Director of Nutrition, the Speaker of the County Assembly, and the Chairman, the Chairman of the County Health Subcommittee, Stephen Chamgorik. I hope I got that name correctly. Yes, Chamgorik. All the members of the county leadership, partners who are here from as well as the Ministry of Health, Obstetric Services Unit, Ministry of Education. Dr. Haga, I'm blessed to see you here, as well as PIC team. I'm happy to join the team here to celebrate the success of Vision Impact Project. I wouldn't be here if it was not for the invitation of CBM, David Munyendo, the country director. Thank you, David. I have been here before, met Dr. Stonik when we were still agonizing on how best we can improve eye care in this county. And then I've just moved on, so I come with different hats. Part of me celebrates the CBM bit, and part of me is now with Nutrition International. And if I look at what we are trying to achieve, I am greatly encouraged. Why? Because we are all focused on one thing: having better chances for life for everyone, be they children, be they adults, be they young people. Better chances cannot be realized if you don't have good eye health. Better chances cannot be realized if you don't have good nutrition. At Nutrition International, we say we focus on nutrition because nutrition is the difference. I recently read a scientific paper, and in that scientific paper, based on studies from a number of countries, it states that for a young child who has good nutrition, their brains develop better, they would perform well in school, and they have better opportunities as they grow. And that is the reason we emphasize on nutrition. So we can have good eye health, which is important. We can have all the support we need, but we must also make sure that we have good nutrition. And when we talk about good nutrition at Nutrition International, we are focused on the triple burden. There is undernutrition, there is micronutrient deficiency, and there is what's sometimes called overnutrition, which presents by way of obesity. Here in Bomet, Your Excellency the Governor, together with your leadership, you have prioritized not just eye health, but also nutrition. And today, we are here to celebrate so many things that will be manifested by way of launching the eye health policy, as well as comprehensive eye healthcare strategic plan that has been developed with the help of the County Assembly. I wanted to us to celebrate the County Assembly for the support and the good working relationship. But it would be inadequate if I add part of what they have done. We've worked with your government, together with the County Assembly, to also develop. And in fact, you did launch the first ever sub-national food and nutrition policy. So for these two, they are aimed at ensuring that children and adults have better life chances. Would you please just celebrate the county by way of thank you so much. And someone did talk about, I think it was, I forget the name, the earlier MC, about the importance of multi-sectoral approach. So today there are so many players when introducing the teams here. Education, and I'm happy to see Dr. Aga again. I see health, I see agriculture. Every sector is important for our work. I'm happy to report, and I'm greatly encouraged that we have been able to develop a multi-sectoral county nutrition action plan. So when we are talking about eye health care strategic plan, the importance of multi-sectoral involvement must never be underemphasized. So we are happy for that and we celebrate you. When we started here, I know in some setting the governor, Your Excellency, you did say you don't want to be embarrassed where we started from in terms of how the county was performing nutrition-wise. So for who have taken time to look at government records, especially the Kenya Demographic and Health Survey, you will remember that the KDHS report of 2014 showed that for every 10 people you interact with in Bomet, 4 of them were suffering from undernutrition. About 36%. I am happy, Your Excellency, that for the period we've worked with you and the leadership of county government, from the most recent KDHS survey, now we are talking about 2 people only out of 10, 22%. And what does that mean? If you just focus on children, it means that for every 10 children, 8 of them have a good chance of having really active brains to perform well in school and realize good outcomes. Only 2 are remaining, and we are not forgetting the 2 out of 10. That is why I'm really grateful that your government has continuously invested resources in nutrition. When we started, there was only 556,000 for nutrition. This year alone, up to now, almost 80 million has been mobilized for nutrition in this county. And 1 year alone, as we speak, we're talking about 15 million from the county government. I'm not adding things from us. Can we clap for the government? Thank you so much. As I close, I want to just reassure you of the commitment of Nutrition International to work with stakeholders like CBM to continue engaging and supporting some of these indicators or issues that affect the good health and good performance of the county. And for that reason, with your permission, Professor, we hope that we'll engage with your office and the county government to develop a county nutrition bill so that we can ring-fence and protect and sustain the gains that have been realized over time, be it in terms of resourcing or in terms of sustained focus on nutrition. So we are committed and we are happy to be there. So thank you so much, and thank you again, CBM, for this wonderful achievement. Thank you.
Thank you very much. And before I invite the country director of CPM, allow me, Your Excellency, to invite Emil Langat, who is a great beneficiary of this program. She came all the way from Kanai just to give us the live experience of how our life was transformed at the sea of CPM. Let's appreciate her as she comes.
Your Excellency, Professor Hilary Barchok, and all protocol staff. Bwana asifiwe. Nikisimama hivi, I am a living testimony. On 11th March 2023, nilikuwa tu natembea kwa barabara nikielekea kwa kazi zangu za kawaida. Little did I know that I'm seriously sick. Nikaona group ya wamama wamekusanyika na ninawajua majirani. Nikauliza ni nini inaendelea. Wakasema kuna group ya from the Nwek wanaona watu wenye wana shida za macho. So mimi nilikuwa nafikiria nimezeeka, niko na shida ya kuona. Sasa nikaenda nikasimama hapo nikitaka kupimwa ndio nipate miwani. So community health worker akanifanyia check-ups hapo kidogo, akaniambia yako unaenda kuonekana na madaktari from the Nwek kwa kanisa yenye ilikuwa mbali kidogo inaitwa Kapkesembe AIC Church. The following day, sasa hapo nisikuwa naona tena mimi ni serious ninaweza enda, so I took almost some days. So the same community health worker akasitiza sana, akanipigia, Amy please enda kwa check up Friday, hiyo ni tarehe 15 after 4 days. So nikaenda huko nikaonekana na daktari from the Nwek, akaniambia shida yako sio ya miwani, unaenda the Nwek. Nikastuka kwani mimi ni mgonjwa. So nikaenda nyumbani nikamwambia mzee nimeambiwa unaenda the Nwek, akasema mambo ya kama ni daktari twende. So on 20th March tukaenda the Nwek, nikaenda kuona daktari through the big vision program. So nikaenda the Nwek nikaona daktari, nikafanyiwa check-ups mingi sana. Daktari akasema shida yako Emily haiko kwa macho. Sasa shida ni nini? Sasa by that time shida yangu tu ilikuwa kuona, sikuwa naona mbali, na sometimes sitaki kelele sana hii kwa kanisa speakers sikuwa nataka, na nilikuwa na headaches sana headaches. Sasa huko tena daktari akasema shida yako Emily haiko kwa macho, ni kama iko kwa nerves ndani. Kwa hivyo enda kwa MRI. Sasa hapo dunia ilikuwa kama imeisha kwangu. So the following day tukaenda detain. Hiyo ni tarehe 21 sasa. Tukaenda MRI detain. Tukaambiwa sasa nikaingia kwa machine, nikaambiwa sasa enda kwa results, ikiingia kwa simu urudi kwa daktari mwenye alikutuma. Usuri by the grace of God your results ilitokelezea the following day very early in the morning by 6. Results ikaingia kwa simu the same day. Tukaenda the Nwek, hiyo ni 22nd March. Tukaenda kumwona daktari, akasema vile results imeonyesha wewe uko na brain tumor yenye inaitwa tuberculum cellular meningioma. So nikamuuliza daktari sasa ni nini inaendelea? Sasa akasema sasa hiyo sasa tumeenda wote sasa. Familia karibu familia wote tumeenda huko sasa, tulikuwa tumeogopa. Sasa kusema brain tumor, kitu ya kwanza iliingia kwa akili ni kansa. So tukaenda tukaongea na daktari, akasema hii inaweza tolewa. Sasa sasa akili yangu sasa nikafanya tu flashback, nikahesabu 1 2 3 wenye wamefanyiwa na hawakufanikiwa. So tukarudi nyumbani, tukaambiwa sasa muende mkifikiria. Sasa tukarudi nyumbani, hiyo wiki moja sasa kurudi nyumbani ilikuwa sasa nimehesabu tu, nikiona mtoto akicheza cheza ninasema by next year huyu mtoto sitakuwa namuona. Sasa kila kitu nikifanya nasema hii sitakula. So I thank God for the program. That is why I am alive today. Sasa tukamuuliza daktari tena, sasa kama inatolewa nani anatoa na inatolewa wapi? Akasema tutapanga, ukikubali tutakupangia. So tukaenda nyumbani, tukafanya maombi. Mpaka nikafanya kwanza mkutano na mimi. Sasa nikasema this is my life na ni mimi peke yangu. So take courage na nikarudi huko. Nikamwambia daktari, I am ready for the surgery. We will do the surgery and it is well. Akasema ni hapa tu tenwe. Sasa nilikuwa nafikiria hata anasema ni kwingine. I thank God for the doctors from Tenwe. Wako na moyo wa kusaidia. Wakaniongelesha kwa lugha safi. Mpaka mimi mwenyewe nikakubali nisaidiwe Tenwe. Wakaona program yao ni congested. Sasa hiyo ni sasa ilikuwa ni 22nd. So wakaona from 22nd March. Wakaona kwa program ni wengi wanafanyiwa surgery, meaning sitapata nafasi mpaka May. Sasa hapo nikapata moyo kidogo, nasema kumbe sio peke yangu, kumbe ni wengi, tuko wengi. So tukidogo hiyo daktari akasema so muende, wacha tukupangie. Mungu akijalia utafanywa pengine May katikati. Tukatoka sasa hiyo siku hiyo ni sasa nilikuwa nataka nifanywe haraka, kama ni kwenda niende, kama ni kuishi niishi. Juu watu wanakuangalia na macho ya huruma, anakuona kama kesho utaamka. Sasa nikasema hiki kitu si wangefanya haraka iishi. So by the grace of God again, on 29th March, tukapata simu from Dr. Temboy. Akasema Emily, uko wapi? Sasa hiyo niko tu nalala kwa nyumba, sitoki. Akasema niko nyumbani. Ni nini? Akaona nimestuka, akapigia msichana simu. Akapigia msichana wangu simu, alikuwa hapa Longisa internship. Akamwambia Mori, enda ongea na mama vizuri na umlete kesho. Hiyo ni 28 sasa. Umlete kesho 29. Sasa msichana kuja kuniambia tena wamesema ukuje, nikasema ama daktari amejua sitafika May, ila alisema. Ndio wameharakisha mbona. So sasa mzee ndio tunashika barabara mpaka Tenwe. Kufika huko sasa sina moyo kabisa. Tukaenda tunatafuta yule daktari, akatupeleka kwa kaunti kidogo.
Na tep question. Kiko ima ngonya kwa mjeri yote. Yo? Kiko ima.
Daktari akatuongelesha akasema hivi.
Akiteba mniambie.
Unasikiaje? Nasema ni mbaya. Ni mbaya, nasikia mbaya kabisa. Nataka kama nikusaidia unisaidie. Akasema kuna daktari mwenye amekuja kuona the program. Anakuja ameona kuona vile program inaendelea. Sasa tungependa akuone ya aende. So nikaitiwa huyo daktari. Mzee sijui ni yaiti ya bodi mzee. Sasa huyo akakuja akaona ilikuwa ni computer. Na ananiangalia na macho ya huruma tena. Anasema things are not okay. Kidogo anasema Emily, chiara. Me I'm an expertise. I'm experienced. Kwa hii kazi ninaweza toa hii. Sasa hiyo ni kama kitu ilitoka tu kwa mkeke, yani nikapata amani at least kidogo kuna hope. Sasa wakaenda wakaongea huko nje. Sasa kidogo akarudi. Kuna wengine sasa kabla kina huyo Dr. Kipoi wako hapo. Daktari akatoka kidogo na akarudi akasema, "Me I'm traveling tonight." Sasa kama tena nimefinywa na huyu tena anaenda na alikuwa anasema amezoea kufanya. It was a very serious thing. Sasa akasema isipotolewa nitakuwa kipofu. Juu imekaa hiyo kitu ilikuwa imekaa for 5 years. Ninatembea kumbe mimi ni maiti. Kazi mimi nilikuwa nafanya. Ati ungesiria anytime any moment juu ilikuwa imecongest imefinya nerves. So by that time jicho moja ilikuwa imeenda tayari, ilikuwa imefunikwa na hiyo kitu. So ni moja tu ilikuwa imebaki. Sasa akasema Emily usaidika haraka juu inaenda tena kufunga macho ingine. Utakuwa kipofu. So nikamwambia wewe ndio utanisaidia juu unajua utanisaidia. Na for sure huyo mzungu alipostpone flight. Huyo wa big program akapostpone flight kunisaidia. Sasa kasema kama ni kukusaidia ni leo. Na ujue umekuja tu na ujui ni nini inaendelea. Kama ni kusaidiwa ni leo. Sasa madaktari wakafanya ile wanaweza. Emily kubali ya kusaidia pia aende. Sasa hiyo nikakubali tu shingo upande. Lakini kwa kweli nilisaidika the same day nikakuwa admitted. Nikafanyiwa sasa very early in the morning, nikaingia theater saa 1. Nikatoka saa 12 jioni. Saa hiyo watoto wamelia wanafikiria mama ameenda. Kila mtu ameenda. Mtu anasema wacha tuende tusikie habari nyumbani, lakini mimi ndio huyu leo nimepona. Hiyo kitu ilitolewa na ikapelekwa ikafanywa wakafanya biopsy. Results ikatokelezea it was non-cancerous. That was my joy. Na tena ingawaje jicho moja ilienda, ninashukuru Mungu ninaona na hii moja na Mungu amenipea nguvu. Kila kazi ya nyumba mimi nafanya, kupika hata kulima. Ninaweza lima hata kuanzia asubuhi mpaka jioni na mimi ndio huyu. Na I thank God so much. I'm a living testimony. Ninashukuru Mungu kwa madaktari wa Tenwe. Maana hata hawakuniachilia. Wangeniachilia niende nifikirie, nisikie public opinion, singerudi. Jumutu anakuongeza anakuambia Tenwe, fulani alienda. Lakini ninashukuru Mungu sikupewa hiyo nafasi ya kwenda kufikiria ndio nirudi. Mwisho baadaye nilikuja kuelewa kumbe hawakutaka niende nisikie hiyo public opinion. Walitaka tu wanimalizie hapo na that was my prayer. Na ninashukuru Mungu sana. Kama wewe ni daktari, how you handle your patient matters a lot. Sio kutibu. Yani daktari tu akikuongelesha tu vizuri. Unakuona tu nasikia mpaka unajipeana kwake. Unaamini tu ni huyu. Na kweli niliamini na nilisaidika. Sio wote wenye wanaenda kwa dieta na wasitoke ndio wamekufa na hiyo ugonjwa yake. Mwingine hata pengine mishandle ama kumuongelesha na ila hasira. Mtu anaona huyu ninaenda. I thank God for that. Hiyo wamesema serving with faith. Faith matters a lot. Kama daktari shikana na huyo mgonjwa wako, shika imani. Umwambie kuna Mungu mwenye anakuponya na kweli niliponywa. I thank God so much. I am happy now. I can do everything kwa sababu Mungu alinisaidia. So watu wa Tenwe peleka asante zangu huko. Ninashukuru Mungu sana nilisaidika. Nilienda review on July. Na nikaambiwa tena kama juu after the surgery daktari alisema it can reoccur. So after 1 year ukuje for another uende MRI ndio ukuje. So last year July nilienda tena MRI ingine retain na nikapeleka results. Ninashukuru Mungu yani ni kama iliisha, hakuna ionekane hata wakiweka kwa mashine haionekani. So I thank God so much for that. God has done me so much. Thank you very much. Kama wewe uko hapo na wewe una hiyo shida, amini kwa daktari. Usiamini kwa public opinion. Na ukwe wewe mwenye maisha ni yako. Thank you so very much.
Thank you very much. Asante sana. What she's basically emphasizing, Your Excellency, is that of late we have been organizing several medical camps.
Nilikuwa naomba, nimesikia wakiongea hapa kama hiyo kitu inaisha ya CPM. Isikuishe kabisa, msimalizie, iendelee. Kuna watu huko, kuna watu mashambani huko, hata kuenda kwa hospitali jamani ni shida. Hawanga kuja kutuchokora huko kwa nini? Kwa family, kwa risa. Mimi singetokelezea. Na sisemi nilikuwa nakosa transport, lakini tu hiyo tu hata unajua kenye umeletewa tu mpaka kwa mlango unaingia tu. Kwa sababu ningekaa singeenda kwa hospitali, ningestukia tu nimesirai tu hapo hivi ama maji yote inaisha ndio nipelekwe kwa hospitali. Kama sitakuwa na singepata tena usaidizi haraka. Kwa hivyo hiyo isiishe baba na jamani. Mshikane nao watu jamani. Ndio wengine wasaidike.
Thank you very much. So, just as I was saying, we have been organizing several medical camps, Your Excellency, under your guidance. She is a beneficiary of one of such medical camps. Medical camps are very essential because people who never knew they had any condition, and if they attend those medical camps, chances are they will get to diagnose their conditions early enough when they are in a position that we can help them. So that is a public testimony, and that is why it's very critical for us to continue holding several of these medical camps, jointly with CPM, jointly with NWEC, because the more we engage the people, the more we manage such conditions. And I also want to emphasize again, just as you shared, CPM, please stay around. We need to hear more of such testimonies. Your Excellency, I also want to emphasize again that recently we signed you signed an MOU with NWEC Hospital, so that we'll be having an exchange program of doctors and consultants. Apart from that, I also want to confirm to everyone who is here that we now have a neurosurgeon in Longisa County, Referral, Dr. Davis. And Your Excellency, Dr. Davis has been working so closely with NWEC, and going forward, we'll be having more of such surgeries in our hospital and county referral of Longisa. And because this story imeshika sana na ni ya NWEC, let me welcome Mutai to speak to us on behalf of the CEO and the chairman of the NWEC Hospital. Karibu sana.
Your Excellency, Professor Bachok, our Governor, Deputy Governor, Mheshimiwa Shadrach, and writing on the protocol that my brother laid just before the testimony to make my work easier, because I don't understand the protocol. Good afternoon, and praise the Lord. I stand here this afternoon on behalf of our CEO and hospital management and our staff to say a word on behalf of NWEC. And before I say a word, Your Excellency, let me ask my team to stand again, and I'll say something. The team from NWEC, kindly stand. We have come here, Your Excellency, as NWEC, because we really value this occasion. We reflected on the impact it has caused since it was started, and we are here to celebrate with you. And generally, we have actually almost closed our eye unit. We have everybody here among the team and our consultants. Dr. Paposa, one of our consultants, Dr. Munyi, and the surgeons who are here, cataract surgeons, and the whole team, Mary and the whole team. We are very excited to be here today at NWEC Hospital. And I just let me request them to stand. Thank you for coming. and we extended HEC Tenor Hospital. We valued the partnership with our county and all our partners, the CPM, and all the team. I know the other speakers lost their speeches, but me, I was sent by the CEO, Nachunga kazi sana, so I've kept the speech here. And maybe I'll say a word, then I'll read my CEO's speech, and then because they'll take a report and say, he didn't read your report, he said his own words. So, Nachunga kazi sana. So, but we are very grateful, Your Excellency, and this program has really impacted a lot. We've had the testimony. And I know it was more of the cataract, refractive errors, and eye infections, but it has gone beyond that. We've had a testimony of someone with a brain tumor that was diagnosed through these initiatives. And we are so grateful because we know lives have been touched. Dr. Kishang, we are grateful, and the whole team and CPM for supporting us. Now, allow me to take care of my work by reading the speech of our CEO, Mr. Benjamin Shelley. Where do I start? I know you have written, Your Excellency, Professor Hilary Barchok, Governor of Bomet County, distinguished guests, partners, ladies and gentlemen, good afternoon. It is with great immense pride and gratitude that I stand before you today. I'm the one standing on his behalf to mark the successful completion of Vision Impact Project, transformative initiative that has significantly reduced vision impairment and preventive blindness in Bomet County. Today, we also celebrate historic milestone, the launch of Bomet County Comprehensive Health Policy, that I can also see there, and strategic plan ensuring sustainability of these achievements for generations to come. I extend my deepest appreciation to the county government of Bomet, led by His Excellency Governor Professor Hilary Barchok, for his unwavering support and dedication to improving high health care. Your leadership has been instrumental in making quality high health accessible to all. This project has demonstrated that strong public-private partnerships can create lasting change, proving that collaboration is the key to sustainable healthcare solutions. A special thank you goes to German Federal Ministry of Economic Cooperation and Development, PMZ and CPM, whose support over the past 3 decades has been invaluable. Your trust in HEC Tenor Hospital as an implementing partner has enabled us to strengthen our systems, enhance service delivery, and maximize every resource for long-term impact. We look forward to continued collaboration in transforming lives through improved high health care. We also acknowledge PIC, Dr. Ron is there, PIC Vision Limited, whose revolutionary mobile screening technology allowed us to seamlessly screen over half a billion residents and efficiently track patient referrals. This innovation has been a game changer in improving accessibility and timely interventions. Additionally, we extend our gratitude to the Kenya Society for the Blind, whose contribution of nearly 20,000 spectacles has significantly improved the vision and quality of life for many. Their rehabilitation services and the renovation of Education Assessment Resource Center has provided crucial support for children with visual impairments. We recognize the Ministry of Education, the Teacher Service Commission, the National Council for Persons with Disabilities, and the State Department of Gender and Affirmative Action for their instrumental role in this initiative. Your commitment to inclusivity and empowerment has ensured that children with visual impairments receive the necessary support to thrive in education and beyond. While we celebrate these achievements, we must also acknowledge the challenges that remain. Inconsistent supply of essential eye medications, many patients require long-term treatment for conditions like glaucoma, face frequent shortages. We urge stakeholders to strengthen supply chains to ensure uninterrupted access to these vital medications. 2, weak data capture and management. Accurate data is critical for effective service delivery. Investing in modern data systems will enhance efficiency, track patients' outcomes and guide future healthcare strategies. 3, the need for continued community and school screenings. And I think one of our ladies who gave a testimony has really emphasized that, the continuation of the program. Early detection is the key to preventing blindness. We call upon policymakers and partners to sustain and expand these screening programs to ensure no one is left behind. 4, shortage of specialized high care professionals. The lack of subspecialties such as glaucoma and retinal surgeons forces patients to travel long distance for treatment. We must invest in training programs, scholarships and partnerships to bridge this critical gap. In conclusion, while we have made remarkable strides, our work is not yet done. By addressing these challenges through continued collaboration, investment, and commitment, we can build a stronger, more inclusive eye care system. Let us move forward together, ensuring that quality eye care remains accessible to all. Thank you. And that is the speech of my CEO. Can you clap for him? Otherwise, we are so grateful for Your Excellency and the team and our partners for your support. Many lives have been touched. I'm a testimony, and in the spirit of CPC, I can say you have exceeded the expectations. And may God bless you. Thank you so much.
Asante sana. Thank you very much. So I want to now take this opportunity to invite Country Director of Christian Point Mission, Mr. David Munyendo. Karibu sana.
Your Excellency, Professor Hilary Barchok, Your Excellency, Mr. Shadrach Rotich, the Deputy Governor, all protocols observed. Good afternoon. Good afternoon again. I have a team here that I want to stand, because sometimes you give a speech and you forget about your team. So CBM team, where are you? Be upstanding wherever you are. I want you to be acknowledged. There they are. We have a few here. We have some somewhere. Even some is there. Let's appear this team, please. Thank you so much. CDM works through partnerships, and there is one here who has not been acknowledged. So MC allowed me to acknowledge him. We have the CEO of Sabatia Eye Hospital, Mr. Wycliffe Were, and his team. Please be upstanding. Okay, thank you so much. Your Excellency, much has been spoken. For me just to give a few remarks, because the chief guest will give the full speech on CBM's behalf. In 2020, this was once an idea, a VIP. And I remember the first time we had a meeting with Dr. Gishangi here, it was just like a dream. And initially, we wanted to package results and sell to donors. So it was branded Development Impact Bond. Then after some time, it didn't sell, it didn't work out. So we felt like perhaps we need to change the strategy. And so we thought of coming up with a more enticing kind of brand. So we co-created a Vision Impact Project. And in the year 2021, we embarked on the journey of developing, designing, and planning and setting targets. So I want to thank my friend here, the Deputy Governor, for opening the doors. The first day we stepped in Bomet, I remember even the chair I sat on, today I sat on it again. I don't say thank you because, why not because of you opening the door? I'm sure today will not be a story to tell. So I really want to thank the office of the governor, because through your team, we got amazing support. The CHMT is here, the CS is here, we have all the directors here, and the team is just an amazing one. And this morning I learned that Bomet, you're used to being number one. That was just an amazing for me, that you're used to this. So even this one is just nothing, and I'm sure you're expecting much more. And I've been given a challenge that don't end. Stay around for some time. Now I'm just wondering, because my boss is here,
It's true, projects come and end, and this is one of them. But it's true, partnerships are established and will stay forever. So I'm sure, Your Excellency, we are here to stay. I want to appreciate Tenwek Hospital because we have been here for around so many years, since 1996, working with partnership through Tenwek. And I think the challenge we had was how do we bridge the gap between the private and the public sector. And I was told this morning, Tenwek is part of the county. So whenever they do the introductions, they don't say we have a private partner there, Mission Hospital, and we have the public facilities here. It's part and parcel of the county ecosystem on health. So this is very amazing because at times you may struggle when you find that you have a private entity here, and we have the public sector here. So Tenwek, thank you so much. The CEO's representative, we really appreciate and just pass my sincere appreciation to the team. Now, we are very ambitious in this project because we work in 7 counties and Bomet is one of them. So we set a target of screening and treating 5.3 million people out of the 8 million population. And for this county, we set a target of screening 80% of children in school and 60% of people at the community level. And it's really amazing. The initial idea, which was somehow wild, that Bomet, it was like a joke, and you hit 100% score. Appreciate yourself. Thank you so much. Really appreciate it. I've also learned a lot from this project, and to be honest, you have challenged me. And sometimes I wonder, where do we go wrong? It's because sometimes, as partners, we don't really talk to the people who make decisions. And for this case, Your Excellency, I must really appreciate your members of County Assembly. It's an amazing team. For a very historical record, you're able to pass the comprehensive eye health policy in a record of days and hours, not even months. And this is something that people struggle with. And again, in a record of very few days, you're able to develop the strategic plan for the county. So now, for all partners who will be coming to Bomet, this one becomes a framework of thinking, planning, and making decisions. So I want to thank you and wish all of us a more exciting future as we go beyond the VIP period and explore much more what else can we do with these amazing frameworks. Because for me it's a challenge, and we don't exit. We only transition in terms of priority areas and how we allocate resources. So please don't be shocked, Your Excellency, if you see me knocking on the door once again. Because for CBM, we do programs in the areas of education, in the areas of socioeconomic empowerment, rehabilitative services, and so many other areas. So eye health is just one of them, and I'm proud that Bomet County has made it possible. Thank you so much.
Thank you very much, Asante sana. On behalf of the Directorate of Special Needs Education, I want to invite Mr. Frederick. Karibu sana.
Your Excellency, Professor Hilary Barchok, Governor of the great county of Bomet, the entire county leadership represented here, both executive and legislative arms, the different partners whom we've heard from today, and whom I've had the opportunity of meeting in the course of the implementation of this project, invited guests, ladies and gentlemen, good afternoon. Allow me, Your Excellency, and the entire Bomet team to join you in celebrating the achievements and the performance of the VIP. I am happy to have been associated with it right from the beginning up to this point when we're celebrating its achievements. As a Ministry of Education, and specifically the directorate that I head, we are concerned about coordination of education services for children with disabilities and other special needs. And basically, the message that we give is that education in this country is a basic fundamental right for all children, regardless of their abilities or disabilities. And that's why the Ministry of Education was very excited when, in the design of the VIP, there was a strong component and many interventions around education. For instance, we've been told about the assessment, the screening that was done for the children in schools, the renovations, the trainings of the teachers. And that proves that there's a very strong nexus between eye care, eye health, and education, especially quality education. So this afternoon, Your Excellency, I am happy to say that in the implementation of this project, many children have gotten a chance either to get their eye problem sorted so that they can continue with quality education, or they have been pointed to the right direction in cases where it has been established that they need much, much more, especially in terms of rehabilitative services. So the Directorate of Special Needs Education, Your Excellency, is happy to work with the county government of Bomet in helping those children who have been identified as having problems with their eyes beyond the treatment that they might have gotten, or any other disability, because we believe that these are children who, if given the chance, like the person speaking to you, who managed to get the chance, they are able to contribute meaningfully to the development, not just of this county, but of the entire country. Thank you very much, and I believe as we come to the end of VIP, I can only say, long live VIP and long live the County of Bomet.
Thank you very much. Now, on behalf of the Ministry of Health, led by Daktari Maalum as an Adentwale kama mimi tu, I'll invite Mr. Dr. Kishak to please come forward to give his remarks. Let's appreciate.
Thank you very much, Chief Officer. Your Excellency, Governor of Bomet, Professor Yoel Bachok, Excellency Deputy Governor, Shadrach Rotich, our Chief Guest Bakri Nyan, the Speaker of the County Assembly. My name is Dr. Michael Gishangi. I am an eye doctor working for the Ministry of Health, and I bring greetings from the Ministry of Health. First, before I make my remarks, I want to state that I traverse most parts of Kenya trying to understand and support the health system, the eye health system in the country. And today I'm very delighted and very happy to be with you, getting an example of what I would like to see, or what we try to emphasize that others should do. On the 21st of April, the year 2022, is when we launched the Vision Impact project. I clearly remember very well. It was at the Safari Park Hotel, and the Ministry of Health led the process. And our role, especially as the ministry in the national government, has remained providing technical support to the counties. And we have done that faithfully, bearing in mind that eye health or interventions in eye health have very high return on investment. We did some studies in Kenya some years back and demonstrated fourfold returns on investment, meaning that if we put in 1 shilling, as a result of the interventions, we get a profit 4 times that. Your Excellency, through your great leadership, we note that partnership works, and it is working here in Bomet County. We see partners, new partners, joining with other partners who have different strengths, working in the same sector to see more effective utilization of resources towards achieving universal health coverage. For example, CPM and PIC, CPM and Kenya Society for the Blind, and so forth. But we also see partners building on top of previous partnership that may have existed in the course of time. For example, the eye care, the eye unit we were walking through was initially built by one of the partners called Salus Okuli, and then the partnership ended that time. And CPM, we see CPM coming to ride on that to improve, to make sure that the resource provided is much better utilized. And it is only through partnership that we'll be able to achieve universal health coverage. Now, I would describe Bomet healthcare system as one of a working healthcare system or a working health system. And health system starts even from the community. We have seen the community health workers, expressing themselves and talking about the effect VIP has had on them. We have seen different sectors, education, social protection, and all that, multi-sectoral approach talking about here. We see the support CPM and other partners have provided in terms of infrastructure and technical and equipment, all these geared towards ensuring that we deliver high quality services. As the national government, and when we go back and as we continue traversing the country, we'll continue spreading the news of what is happening in Bomet County in terms of delivery of health. And we will encourage other counties to come and benchmark. I know next week I'll be visiting another county in the Mount Kenya region, and later on another county in the Lake Basin. We'll share all this good work, and I hope you will welcome them to the county and see what it is that they can learn, because universal health coverage will be achieved when all counties are able to deliver quality services as you have shown. As a ministry, as a national government, we shall continue to give technical support. And in the recent past, we've been talking about integrated people-centered care. Integrated people-centered care is taking into consideration what is the nature of work somebody is doing. I am a tailor, so look at me in that context. And also other circumstances, look at the other sectors and so forth. And I can attest, this is what is being demonstrated in Tenwek. I mean, not in Tenwek, but in Bomet County. While I came to Bomet, all the amenities have come. I've never felt that Tenwek is a private facility compared to Longisa County. I just walk in and I'm met the same way as the other. And this is a good show of, how to work together in a health system. Having said that, and once again, thanking you, Your Excellency, for the good leadership for this county, I want to still present more technical documents that will help the county moving forward in planning and evaluating themselves. Earlier on in the morning, I presented the report of the RAB survey that we did last year. And in principle, it says that in every 1,000 people in Bomet, 2 are blind. And we know why they are blind. And we know they can be treated. And we also know that a number of them can be prevented. Engaging the primary healthcare system, engaging community health workers, working all together, we can be able to achieve more. I wish to request my colleague, Dr. Bitok, please come and assist me. I did not come alone. Dr. Bitok works with us at the Ministry of Health. And with your permission, Your Excellency, I think I will request Dr. Sitonik, the CEC for Health, to receive the report. These are also technical documents which are made easy for use at the county level. We have interpreted them to that ease.
Let's appreciate the team as they present the policy lecture. Thank you very much.
Thank you very much.
Asante sana. Thank you very much. Your Excellency is speaking on behalf of the Ministry of Health. Ministry of Health basically is a government department that assess how we deliver services across the country. And just as he said, Bomet is leading. Hiyo ndio tu amesema. Na msitupigie tu makofi. That is why he's saying other counties should come and benchmark in. Hapa kasi tu. So before I give my remarks, let me invite Sio Pauline mwenye ako na sisi hapa just to say a word.
I've been ambushed, but nevertheless, I have the words, Your Excellency, sir, the governor, the deputy governor, all our partners, the members of the county assembly, all distinguished guests, ladies and gentlemen, good afternoon. I'm privileged to stand in front of you to say thank you for this momentous event in launching our policy. We are partners in terms of multi-sectoral approach, given that we have the mandate of protecting children with disability. And before I speak, we have an officer who is in charge of the social protection and children's section, Mr. Kimeto. That is the person in charge of people abled differently in the Department of Gender. Our department comprises of 6 units: gender, culture, social service, library, social protection, and children's services. Since I will speak again at the end to give a vote of thanks, allow me to tell our partners, especially CBM and TENWEC, thank you for augmenting the power of executing our mandate in Bomet. Karibuni sana.
Asante sana, Sio. Your Excellency, let me make some few remarks. One, I want to really confirm and the support that we have gotten through this CPM. Your Excellency, the development of the human resource, and Your Excellency, you are a beneficiary of those services yesterday when we were in Sigor. Just to confirm that with the support of the CPM and your office, Your Excellency, we now have the eye services in all our sub-county hospitals. Initially, we only had to use those eye clinics in Longisa, but now if you go to Kapkoros, if you go to Tegat, Sigor, and Danai, you'll get all those services in those facilities. Your Excellency, again, you're expecting more of our staff from school in the next 2 months. We'll be deploying them again now to high volume health centers, starting with Bomet Health Center, so that at the assembly, ukiwa na shida wanamalizia tu Bomet Health Center. before they come to Longisa. So we'll be expanding these services again to high volume health centers. And Your Excellency, we also received very good little lamps, and they also distributed for the use in those facilities. And that is, I know I'm saying this just to reaffirm what you saw yesterday. And I want to confirm, Your Excellency, that during the medical camp that we had in Sikor yesterday, over 100 people were attended to in that particular clinic. That speaks to the ripple effect of what CBM and the county government of Bomet have been able to do. And that is why I was requesting that if we continue this partnership, despite the fact that the county government of Bomet were able to attain 100% screening of the schools in Bomet, we haven't attained the 100% screening of the adults. And that is why this partnership has to continue, especially now that we have a strategic plan. And for us to implement this strategic plan, again, as I said initially, it needs a multi-sectoral approach. Your Excellency, because we are having several partners here, allow me to just say some few things about our facility in Longisa. Your Excellency, one, just as it has been said before, and this is one of the leading facility in the entire country. Madaktari tisimame, so that we can appreciate you. Kila mtu mwenye ako hapa, nikisema daktari hata cleaner, wewe ni daktari, so long as you're working within the hospital. Let's all stand up. Anyone from the Department of Health? Wani mumegoma? Your Excellency, this is a great team. And I really want us to appreciate them in a very special way. Let's clap for them. Your Excellency, despite Tukaichina, this team has been going out of their way to make sure that they give the best services that they can to the people of Bomet. Despite some of the negative stories that sometimes run in our social medias, the press conference, and apparently, I think the only one joint press yenye imefanywa bunge by our national representative ilikuwa ya Longisa, hawajaifanya ingine. But despite even that pressure, our staff have always attended to their duties effectively and as it's required of them. It's a great thing. Your Excellency, this facility attended to 16,126 patients in the month of January. In the month of February, they attended to over 18,000. And just to say, February is that very short month. So chances are it could have gone up to over 20,000 people. That speaks to the capacity of the facility. In the eye clinic alone, they were able to carry out, in the month of February, surgeries of up to 256 surgeries. That is under 5 and over 5, which we should appreciate the team because they are doing a great work. Your Excellency, I also want to confirm that today, as of today, the main ward of this facility is designed to accommodate only 32 patients. But today we are having 38 patients, meaning our inpatient is full. And that speaks to the need of why it is even more urgent now for us to equip Mother and Child Wellness Center so that the number of the people who are coming to Longisa can now get even more space in our new facility. Your Excellency, if you look at those figures, it speaks to the trust that the public have with our county referral facility. Najua saa zingine maneno ni mingi, lakini ukikuja kwa ground is when you realize that people are tirelessly working. And that is why we really need to appreciate them. Your Excellency, as I said again, we have expanded the scope of the services that we offer here. Now we have a neurosurgeon, Dr. Davis. We have a psychiatrist, Dr. Fidel, and amongst other services that we initially used to offer. And we want to invite our people to really take the advantage of these available services now in our public facilities because we are so purposed Your Excellency, in making sure that we serve the people of Bomet together with our stakeholders, because at the end of the day, it is for the benefit of the people who are seeking for these services within the county. It's not about this or the other partner, but it is about services to the people that we serve. Your Excellency, I want to say, this is one of the facilities that SHA is working 100%. Any patient who has come here and is registered on SHA or has not registered under SHA and they have all the requisite documents, including the ID and the mobile phone, they are registered here, they pay for the premiums, and they start enjoying the services without paying a shilling. So if there is any other facility that we need to demonstrate that SHA is working, it is Longisa. And as in return, and I'm happy because Duale has given a directive, we hope that because now it's almost 80% of the patients that we are attending to, and we get their returns from SHA, we hope that, again, the county government will now be able to reimburse every 14th of the subsequent month. That is a confirmation from Duale. And if that continues, because Longisa, Your Excellency, as it stands now, and they have claimed over 200 million from SHA. Meaning, if this money are dispersed, and then Longisa should be able not only to expand the facilities that we have, but to also increase and improve other services that are very critical to the county government of Bomet. Your Excellency, we also want to thank our partner and Kenya KMTC Bomet campus. Principal utapewa nafasi na MyCC. But we really want to appreciate the good work and the collaboration that we are having. Your Excellency, you know, as a result of siasa zingine hapo nyuma, some courses were scrapped and moved to other facilities from Bomet chapter. That also saw the reduction of the students who were getting or attending to, being attended to in our KMTC, but with time, then through your effort again, the courses were reinstated, and we have now several students, and in turn, these students help our staff in making sure that our people get the best services that they can. So in summary, Your Excellency, what you are saying is, we are working, it's working. It has been confirmed by our stakeholders over mortgage of ground that health is working, and that is just to speak to the naysayers, the detractors, that we are so focused in making sure that at least during our time, Your Excellency, we move the Department of Health to the next level, and that we will. We will. And to our partners, again, we are doing several sub-counties just to expand the scope of the services that we are doing. And this is where we'll also need your support in terms of equipping. And we are currently building 56 or 60 bed capacity inpatient ward in Kapkoro sub-county. We are doing the same in Danai. Yesterday we commissioned one in Sikor sub-county hospital, which is a radiology unit, a theater, a twin theater. And we have the power med section, the farm store, and then a complete surgical ward. Basically what you are saying is, we want to devolve the services that we're having in Longisa closer to the sub-counties that we come from, so that at least we make sure that our people are enjoying health services closer to where they come from. And allow me again, Your Excellency, to thank our members of the County Assembly for the third time, because of the support that they've given us. They've worked with us through the journey. They've always been considerate when it comes to the Department of Health Services. They've always listened to our issues. We have always engaged, and I really want to thank them. And I hope going forward that we'll continue with the same spirit, so that at least at the end of the term, at least we should be able to point to several things that we've achieved together. With those very many remarks, Your Excellency, allow me to invite my boss, my CC, my CC, Dr. Joseph Sitoni, to make his remarks. Karibu Waziri.
Your Excellency, our Governor, Professor Hilary Barchok, Your Excellency, the Deputy Governor, Mr. Shadrach Rotich, the Speaker of the County Assembly of Bomet, and the Chief Guest for today, the Global Director for Development and Implementation, CBM, Mr. Mbake Niang, all the dignitaries that have been mentioned, representative from the Ministry of Health, Education, our colleague in Sabatia Hospital, Dr. Rono from PIC, all protocols observed. Your Excellency, in the interest of time, allow me to recognize a few people who should come here and we get to know them. I want to start with my colleague CC. I can see Waziri Maina, you can come here, just maybe mention your name and the department you're working because of time.
Your Excellency, our Governor, all the stakeholders present, the doctors from Longisa Referral Hospital, I can see members of the public outside. Good afternoon. My name is Justus Maina. I happen to be the CC in charge of administration, public service, devolution, and special program. Your Excellency, there is a good narrative that was told by a lady from, I think, Konoi, and I think that is a very good story, Your Excellency. That needs to be retold. Other than the fact that the event itself, the story seems to be changing lives. From the linkages that you have established, from the partnership that you have established, I think those stories need to be retold. Thank you, Your Excellency.
Thank you, Waziri. Let me also invite a representative from the national government, the administration side. We have the ACC, Jane Maina. Jane? Yeah.
You've seen too many sunsets, too many days ending in the darkest night. But on your own, you'll never know,
Thanks a lot. God is good, and all the time. Area Assistant Chief, can you stand and wave, Mr. Charles? Okay, I'm Jane Maina, ACC Longisa Division, standing in for the DCC Bomet East, Bwana Ruben Latemo, and representing the office of the County Commissioner and the President himself. Our Excellency Bwana Hilary Barchok and your Deputy, our partners, and all protocols observed. Today we are here celebrating the achievement. And you know, as a government, one of the manifestos is provision of universal health care. So we've achieved. And let's continue facilitating for as the partners come, so that Bomet we achieve in health care. And naona hutaki tuongee sana, lakini nataka kusema ile ingine mandate yetu ni security itself. And our work is to see unto it security is provided to every mwananchi and the government installations. So when you are there in Bomet, know that Longisa Referral Hospital, iko chonjo. Security is here. You know we have our police station there. The chiefs is here, and as we are here. So we continue working together for the betterment of our people. You know, our department is working in conjunction with the other departments in delivery of government services. Thanks a lot, na nimesikia Bomet tuko na pamoja, tuendelee vile vile. Thanks a lot.
Thank you, Madam ACC. Let me invite the principal, KMTC, Bomet, to say a word briefly. Thank you.
Your Excellency, Professor, our Governor, Hilary Barachok, the Deputy Governor, the senior distinguished guests from CBM, the Director, all protocols established by the previous speakers. I want to say hi, good afternoon everyone. Yeah, I am the principal KMTC. I think we have not met with quite a number of people. I'm not very old here. My name is Aris Ongera. And on behalf of our CEO, KMTC, I'm here to pass his greetings to you, Your Excellency. He's your close friend, and he said I say hi to you, and also to appreciate you for what you are doing to support KMTC Bomet. Your Excellency, I want also to echo the same idea that the Bomet County, in terms of supporting KMTC, it become #1, because 30% of the staff working in KMTC Bomet are from the county. And while other counties are struggling, Bomet, we have been supported to the letter, and we really appreciate for that. Thank you also for improving our infrastructure. We have benefited a lot from the NG-CDF funds through supporting our students with the infrastructure and also the bursaries. We can't forget that, and we really want to appreciate you because of your leadership. Your Excellency, what has happened today is a great, great achievement, and it opens a new chapter for KMTC Bomet, in that we are going to now start on optometry, and we promise that by September, we will have an intake for our first group of students, because we have a placement area. Now they will not struggle, and we only want to request that the CBM please partner with us. We'll come and request for a few things, support, and please, we want to acknowledge what you are doing, and we promise that to enhance the care that is being offered in the facilities, if we train our students at the basic level here, then I'm sure your goal will be achieved to the maximum. Your Excellency, you have a big mark in KMTC, especially the history you made in the year 2023 by enabling the uplifting of the courses that had been banned. It is through your effort that these programs were lifted. We are recovering from the shock of reduced numbers, and at the moment we are knocking the number allowed, a population of 800 students, and this is through your effort. Thank you so much. The Board of Directors, KMTC, is just about to finish the tuition block that you can see here, and we really want to appreciate. This block is going to give us a total of 12 classrooms. We are going to have a skills lab there and a computer lab alongside with a big library and some offices. Your Excellency, we only have one request. The terrain of our campus, including the hospital, is quite uncomfortable for people living with a disability. And it becomes a very challenging event when we get students who are not able to move comfortably. They are physically challenged in one way or the other. For them to access the classes which are at the upper round, it becomes a challenge. Your Excellency, I had visited you and we discussed, and the only urgent request we have as KMTC at the moment is if we can have some landscaping, a walkway that is coupled. We have couples from the gate so that those who will be admitted with some disability will be able to access the classes before we are taken to court. Your Excellency, we have enjoyed a lot of support from the hospital, and we really want to appreciate that we have had a good, humble time and teamwork. And we also want to be proud as KMTC, because as you heard, those medical camps, our students have been part and parcel of those medical camps, and we promise we will continue to support with what we have, especially transport and the human resource for the hospital to continue excelling in all the services. Thank you, Your Excellency. Last week, we saw in the newspapers that our campus has been identified for affordable housing project. Your Excellency, we can't thank you enough. And we are only dreaming that we can get somewhere where our students can be housed so that they stop suffering and they also learn comfortably. If you push this project for us, we will appreciate, and our students will never forget you, because they are really going through a lot, looking for accommodation everywhere in Longisa. May you be blessed, and we thank you for what you are doing for us. Thank you.
Makofi kwa Madam Principal. Your Excellency, because of time, let me stop there in recognizing the other guests. I know in such a forum where you have dignitaries of varied positions, it's really a protocol nightmare. Forgive us for the mix-up, if any, but I want to make a few comments, Your Excellency. 3 years ago, when we launched this VIP project, you were here, and I remember one thing you mentioned, that you wanted to see a situation where we could know every person in Bomet County and get to know his or her health status, especially as far as eyes are concerned. I'm happy, Your Excellency, that with the technology we have, with the big technology, we know, or we can screen very fast and get to know them, and even when they don't go to the next referral point, we can always fall back and do a follow-up. The other thing that we've learned from this VIP project, Your Excellency, is what you have always told us, that partnership is key, especially in Bomet. Were it not for this partnership, we will not be celebrating the event of today, where we are closing out this project with success stories and also launching a policy and a strategic plan for our continued endeavor in issues of health. This VIP project, Your Excellency, gave us, opened actually our eyes. We realized that many of the things that we've been assuming can be reached if we go to the person at home. We find people in their farms and we check their eyes, and we would refer them appropriately. This is what happened. And I'm also happy because in that meeting you mentioned something about research. And the rapid assessment of avoidable blindness that was done through the support of the Ministry of Health has shown us the burdens, or the burden we have in our county, in Bomet. Most of the eye problems that we have can be prevented or can be treated. And if you don't even treat, you can channel the people appropriately to the areas that they are. We also were shown that sometimes we assume, like you saw the children from Korara, we went and visited them and realized that there is a big burden when you don't have eyesight. Even for those children to do one exam, it is in millions. So that really has opened our eyes. I am glad that from the day you initiated the VIP project here, even Korara Special School alone has received visitors, their infrastructure has improved, and even the children now are in a better environment. You heard from one of the teachers that people nowadays don't leave their children. They are no longer a burden to them. They have really been assisted. This project that we have has stabilized our health system through all the pillars that we have. But I want to thank Your Excellency, the Committee of Health and the entire Assembly, through the Honorable Speaker, for the advice they have given us. We came together and told them about VIP and the areas we are likely to have challenges. They have helped us, and through your office, Your Excellency, you remember you also approved this policy and it went to the next stage. I'm happy because this has been a sign or something that shows collaboration. With this technology, I am sure we'll be able to screen everybody in Bomet. There is no reason why we cannot screen, because with our phone and our software, you can get to know my problem, channel me appropriately, and even at the receiving point, I'll be able to be seen and be served appropriately. Your Excellency, I know it is not possible to finish in a day the success stories, right from collaboration with TENWEC and the other stakeholders, including the Nutrition International. It is not possible to finish in a day, and I know you are very busy. The Speaker is also a very busy person. Allow me to invite the Chair of the Health Committee to take over from there, and we hear from his side.
Thank you very much, Waziri. Your Excellency, Professor Hilary Barchok, Your Excellency, Deputy Governor, Bomet County, Shadrach Rotich, the Chief Guest of today, Mbake, and all protocol of staff, our Speaker, now our Nainji. Good afternoon. Let me take this opportunity, Your Excellency, to short it because I'm seeing we are running short of time. First, let me thank our donors, our partners, for the work we have done for the 3 years. We are really very grateful. The CPM has shown the impact in our county because they went direct to the community and do the screening, which created a very big impact. Your Excellency, during the screening, we came to realize that we have a problem in Bomet. So let me thank the CPM for giving us to know that we have a problem. It is the same way the NI did, that we realized that we have a problem. In short, Your Excellency, because this, today we are heading up their project, I want to say that we need you, the partners, than the way you need us. We have a problem and we still need you. So let us not make this to be the last, but let us continue making more engagement for our people in Bomet. Your Excellency, the policy, let me thank the Assembly. The Assembly, let me say thank you very much. The work you did even yesterday and for the few weeks, kweli tuliona matunda. I really thank the Assembly through the Speaker for the work done and my committee for the work done to make sure that we have the policy in place. Your Excellency, this is not the first policy that we are launching today. When there is an emergency in the eye, we have emergency and referral policy in place. So, by emergency, we have the emergency policy in place. When we also have the F5. So the CPM, we have sustainable of the project because we have the F5 that will make the finance available for the project. We also have the community health promoters policy. Those are the policies that we have managed in the Assembly. And the community health promoters policy have assisted us a lot in this program of CPM. We also have the nutrition and nutrition policy. That policy also is more of prevention of eye problem in our county. So we have the policy in place. That is the reason why I'm saying thank you, the Assembly, for the work you have done since we start this journey. We also have the policy now, which today we are launching, the eye policy. The four policies before the eye policy, all of them support the eye policy. So, Your Excellency, we expect the outcome in this policy. One of the outcomes that we are expecting is reducing in cases of prevention and also increasing the access eye services in our people. We are also expecting to improve the high healthcare awareness to our people. This policy has an impact in the county, and I want to thank the executive for making this policy to be in place, and the assembly for passing the policy. I want also to thank the assembly for giving the first time to make a budget line for the eye. And Your Excellency, the reason why we need to have the eye hospital to be interdependent is because so that they can have their own things, they can make their own requisition, they can use their money in FI, so that we cannot mix up and make the other one to be a department, a section in a head. We need to have it to own their issues, and also in terms of human resource, they have their way so that they can go to the school and they just expand what we have. This Kenya people are running. Everything is in a speed. So when you left another department outside or a section in a department, itakaa huko nyuma. So we want to make it ikuje mbele kila mahali. That is why nutrition tumeweka iendelee, tumeweka tena mambo ya high iendelee, na hizo magonjwa zingine. Your Excellency, now you know we have a problem through our research of cancer problem, of which I know in your office and the assembly are pushing for that. We are now moving to see how we can manage cancer screening in our county. In County of Bomet, we are looking that every person access to treatment. That is why we are moving very fast to see all the diseases that are giving us problem in this county. In those few remarks, Your Excellency, I want to say to say we have Mheshimiwa who is representing person with disability is in our assembly, and he's also working very fast to make sure that your people with disability are represented well, honorably. So with these few remarks, I want to take this opportunity to show my committee first. Wakuja hapa mbele, my committee, health committee, niwaonyeshe tu, alafu niite majority leader aongoze the other team na speaker. Committee on health, wafika hapa mbele. Committee and my secretariat, wafike. Committee on health, wafike tu ndio wajulikane. These are my committee, they are committee of 7. Mfika haraka kidogo. The secretariat wako hapo, wasimame mahali wako, waonekane. So, Your Excellency, and the team from NI, we have the CPM and all the stakeholders. These are my committee. They can just say their names, and then I'll invite majority to welcome the rest of my colleagues. In my committee, I have a privilege also to have my boss in, a deputy speaker.
Okay, thank you. My name is Leonard Rotich, MCA representing KSON Ward. Also Deputy Speaker of Bomet County Assembly and member of Health Committee. Thank you so much.
Good evening, good afternoon all. My name is Changachit Catherine, a member of the committee and also a vice chair. Thank you.
Good afternoon. My name is Roslyn Chepto, MCA representing Rongana Manaret Ward and a member of this committee.
Thank you. Good afternoon. I'm Mheshimiwa